Dr. Joel, it's a pleasure to see you again. We've had the luxury of meeting a few times at South by Southwest, as I've mentioned in our pre-intro. But I want to jump right in and talk a little bit about who you are and ask you some questions. And one of the first things that I've really been blown away by, and I follow you on a number of different channels, is your work as the medical mythbuster, and it's really been inspiring. So let's talk a little bit about what initially motivated you to use social media in the way that you do to combat health disparities and educate the public.
Absolutely. Well, Aaron, thank you so much for having me here, first of all. And it's always good to see you outside of the South by Southwest bubble.
It is.
But I love that question because it always sends me back to 5 years ago when I really started using social media as a platform to talk and educate about healthcare disparities, especially when it comes to the medical field. And really, it started with my first year medical school. When I came into school, Washington State University, myself and one other student were the first two Black students at my medical school. And I always have to caveat that by saying that my school had only been around for a few years. I began in 2019, and was started in 2015. But still, that meant there was over 150 students that had been started at this school that hadn't, and there hadn't been a single Black student. When I came in, I was thinking a lot about what it meant to be one of the few Black students in medicine at my school, but also how that was a trend that was nationally seen. In the United States, less than 6% of all physicians are Black. And I knew when I was coming in that I was going to be one of those individuals. And I kept asking myself, what did I want my legacy to be when I'm here at this institution? And for me, it really was about inclusion and making sure that stories that were often overlooked could be included. And I think I unfortunately found a lot of opportunities for that to happen. I remember there was this one day where we were talking about cyanosis, which is when the skin turns blue. And I kept looking at myself and saying, I'm not going to turn blue. What's going to happen to someone that looks like me? And I was so nervous to raise my hand and ask the question to my professor because I didn't want people to laugh at me. But I was like, this might be something important. And so I did. And he had a great answer. He said, you can look at your mucous membranes, you can look at your eyes, you can look at your nail beds. There's all these different ways you can tell if someone's cyanotic as opposed to just looking at their skin tone and their skin color. But I remember someone asked me or told me as I was walking out of that room, if you hadn't asked that question, I don't know when the first time I would have actually asked that question would have been. And so I began to notice gaps like that, both in what we were taught in medical school versus what patients knew about their own health versus what's even discussed in the mainstream media. And I decided to do what any Gen Z/millennial, I call myself a millennial, would do. And I took to TikTok at the time to make videos about health inequities that I was seeing, story times of things that I was hearing in classes that didn't make sense, and just studies that were recently coming out that were showing ways that we could be making healthcare more inclusive. So the first few videos really were just experiments, but the more I saw people engaging, sharing, and then telling me that the information was actually helping them advocate for themselves in the hospital, that's when I knew I could actually make an impact through something as crazy as social media.
Well, a few things to unpack there. First of all, Joel is a very handsome man, and so that doesn't hurt, I think, on his on-screen presence. You also celebrated a milestone birthday recently, I think, which was not 40 and not 50. So he is wise beyond his years. And I saw one today that was, I think, recently that you did on root canals. And I have to tell you, fortunately, having never had a root canal, it was hard to watch, but it's really good content and it's very educational. So thank you for doing all that you're doing.
Thanks.
I do want to talk a little bit about the fact that you have had a significant impact, and I was not surprised, but a little bit like, wow, this is really great that he is getting seen in so many different places, and we'll talk about a few of those. But I think from your website, and it's probably higher than this, you have close to 1.5 million followers across your channels, 350 million impressions, which kind of blew me away. That's a lot of impressions.
Yeah.
What I do want to ask you, is there a specific moment or story where you felt like your efforts really made a difference in someone's life?
Yeah, I'll tell two stories in particular because I think, as you said, like I was blown away too. When I started creating this content, there was no way I could have predicted how much it would resonate with people. I was making this because I was surprised by the information that I wasn't learning, and I was hoping that there'd be maybe one person out there, and little did I know that it's millions of people. And I think the reason why is because we don't often talk about healthcare with our loved ones very often. We do talk about it with our doctors. And so sometimes I would post, so for example, you just talked about that root canal video. When I posted that yesterday, I was a little nervous because it was a little bit outside my lane in terms of being more dentistry as opposed to more the traditional medical MD field. but it was something that I kept hearing from my followers saying, I want to see a video about this specific procedure. And even yesterday, I was going through the comments, shocked by how many people said, I've had a root canal. Here's what my experience was. This is what happened to me. And I think that's really what makes my work resonate with so many people. It's talking about something online that you don't often see in a way that provides people education that makes them feel a little bit more seen. But to specifically answer your question, to take it back to a specific moment / story where I felt like my work made a difference, I really have to go back to my first video that I made. That was really in line with the content that I create about healthcare disparities now. And it was about this device called a pulse oximeter. Now, if you go to a clinic or if you go to a hospital, you'll get a pulse oximeter. It's a small device that goes in your finger. It has this red light, and it essentially measures what's called your oxygen saturation, how much oxygen is bound to your red blood cells. And I remember I just started my second year of medical school in December 2020, and I saw a study in the New England Journal of Medicine that said that Black patients are 3 times as likely to have inaccurate, overestimated oxygen saturation levels, meaning that you go to the hospital, short of breath, you have this device put on you, it should read as lower, but instead it reads higher. And when I really dove into it further, I found out it was because melanin actually reabsorbs red light as well. And so because this device uses red light, it reabsorbs, yes, the red light from your red blood cells, but also the melanin, artificially increasing it. That shocked me because I'd done my cardiology unit, my pulmonology unit. I'd never learned about this, even though I felt like this was something that sounds pretty important. And so once again, I took to TikTok and made a 30-second video because that's all I could make at the time. And I started off by saying, what does racial bias in medicine look like? This is a pulse oximeter. And I explained the problem of what it was and why it happened. In that video, it was probably maybe my 10th or 15th video I'd made on TikTok. That one was the first one to get almost like, I think, 700, 800,000 views in 24 hours. And the amount of nurses and doctors saying, I never knew this and I use this device every single day was shocking. And then patients saying, is this what happened to me or my loved one? Fast forward about a year, and I had someone reach out to me on LinkedIn. And it was a very cryptic message that just said, you saved my life.
Wow.
And I was like, whoa, no, you can't just leave it there. Who are you?
That's a pretty profound statement for not any context or follow-up.
And especially on LinkedIn of all places, right?
Right.
I felt like it was just like a strange place to get that. So I said, no, like let's hop on a call, tell me more. And so I ended up hopping on a call with this guy who essentially told me that he had seen my pulse oximeter video, knew that it wouldn't work well on his skin tone. And when he went to the hospital, he started feeling short of breath because he had COVID. Mm-hmm. Doctors were like, oh, you're a young, healthy guy. Don't worry about it. You can go home. You'll be fine. He ended up saying, I don't want to go home because I don't feel good. And I feel like this device isn't reading well on me. The doctors, of course, aren't going to be like, okay, they're not going to kick you out. And so they said, sure, let's keep you here for a night, see if you feel better. He ended up crashing that night, ended up in the ICU, had to get intubated. And they even gave him an iPad to talk to his daughter, who was only like about 1 or 2 years old, and his wife, as if that was going to be the last time that they saw him. But he told me that if he had not advocated for himself, he felt like he would not be here today. But that the video gave him the confidence to be able to say, I have this information that you may not have, which is why I feel like I need to be here a little bit longer. I think that story stayed with me for a long time because it shows the power of equalizing information, but also information that often has not been taught or ignored because it's about marginalized communities who don't maybe make up the majority, but who often in the healthcare system need to have this information because they're overlooked and ignored.
Well, I have to tell you, that made the hair stand up on the back of my neck to hear that story. That's incredible. And like, bless you for doing that. And I'm sure there are millions or at least thousands, if not millions of other people you've helped. I do have a pragmatic follow-up to that, though, given how many people that you do have following in you and how many impressions you get.
Yep.
What's your strategy in terms of engaging or even trying to keep up with the, thousands upon thousands of comments that you get?
Yeah, I hate to say that I really don't. I mean, it's just impossible one. And with my schedule, I mean, I'm a doctor. I'm in the hospital probably, 80% of the day. And so I just can't physically keep up with looking through comments. But what I do is like if I have, usually I'll look at the beginning. So when I post my video first, the first few comments I'll see. And then maybe if I go back the next day to look at it, I'll see the last few comments.
Right.
But then also I get a lot of people who actually reach out to me. specifically will say, hey, like I saw this video and here's something that resonated with me. And those are the ones I tend to see more because it means that someone took an extra step to say, this video resonated with me for this reason. Let me reach out and say something. Or if I get tagged in things, those are the ones I see. But I will say, for the most part, I don't see the majority of comments, which is actually something I do for my mental health as well. I have comments and notifications turned off in all social media apps, and so I don't get notified if I get a message on something, which I like because that one protects my mental health, but two, it means I'm like limiting my screen time and focusing on educating in a way that isn't influenced by everyone else, but the things that I feel like are important. But I'll still read the comments to see if there's things that people want to see more of.
Well, that's smart, and I appreciate the transparency because I can't imagine. I've had a few posts. I know I had one on LinkedIn that I think got, 50,000 views and had probably a few hundred comments, and it took me a lot to pay attention to it because I do try to keep up with them, but there are times where it's impossible. So
Yeah,
that totally makes sense. I
absolutely.
do want to talk a little bit about you've had the opportunity to collaborate with some incredible organizations, including World Health Organization, WHO,
Hmm.
and the FDA. And so, how do these partnerships help amplify your message and reach a broader audience?
Absolutely. I love that question because this is another thing that I could never have expected when I first started my platform is that large organizations that have been around for a long time that have established media or even marketing campaigns would want to reach out and work with me. And so you've mentioned to the WHO, the FDA. Last year I went to the Nobel Peace Prize and got to actually interview the winners of that. I've worked with the American Health Association, American Medical Association. I've even done more traditional influencer brands from Vaseline and Neutrogena. And I think the collaborations allow me to reach audiences that maybe wouldn't find me typically on my page. I think the people who tend to find me are those that either A, have had experiences with the healthcare system already, and so they're looking for answers or experiences. B, individuals that are from communities that are marginalized, and specifically because I talk so much about that. Or C, people that are in healthcare that want to learn more about how do you focus on health equity or what may have I been missing in my education or my training. So lots of nurses, lots of PAs, lots of doctors that follow me as well. Um, but I think how they amplify it is by reaching different audiences that maybe wouldn't follow me, but then now I'm reaching this whole new audience of people that maybe like Vaseline and didn't know that sunscreen is still important for someone who has darker skin tones. But now they're actually getting this content because I'm working with them, or maybe they amplify it on their own page, or through a paid sponsorship, or even through like a YouTube ad. I think even beyond that, though, it's been really cool to be able to connect with other people through these organizations. They'll often bring together other individuals, and so, for example, with the World Health Organization, I worked with the United Nations as well. So WHO is a subsidiary under the United Nations. I actually went to Geneva. They brought us together with 10 other creators who to create this creator council, and we had this awesome opportunity to really meet one another and see the work we were doing, but find ways to amplify each other's works in different ways. So the collaborations have been hugely instrumental in amplifying that message and showing the importance of medicine. And I also try and kind of tailor it based on who and I'm working with. So if it's the WHO, focusing on health and making it kind of global health. If it's someone like Neutrogena, it's focusing on skincare, right? If it's someone like Loop earbuds, for example, who I did one recently, it's how can hearing actually be damaged by loud music. I think it's really fun to try and find ways to infuse science, healthcare, and medicine into all aspects of our life because it really does cover everything.
Well, that's awesome, and I will definitely keep you in mind because I do have the opportunity to talk to some of these organizations, and you know that I'm a big fan. Will always highly recommend you.
I
One of the
appreciate
things that
that.
we talk about on the show that's really important is you do it kind of with everything that you're about, and that is giving back to society or societal
Hmm.
good.
Yeah.
But on top of that, you did also co-found a nonprofit called Hugs For,
Hmm.
and it empowers the next generation of global leaders. Let's talk a little bit about what some of the most rewarding experiences from this initiative are, and how do you see it evolving in the future?
Yeah, that's a throwback for me because Hugs 4 was actually, I created that when I was in middle school as a seventh grader. And it's been, so that was, oh my gosh, 2007. So it's been almost 2 decades that this organization has been around now for. And the purpose of it, as you mentioned, is to empower students in the United States to become global leaders, to think broadly about the world around them. And the just to give a little bit of a background of what Hugs is about, it was started in honor of my grandma. And when my siblings and I were younger, my grandma used to come in to our rooms and take stuffed animals from our rooms And without us even knowing, when she would go back to Ghana, where my parents are from, she would take these stuffed animals and give them to kids in the hospitals and the orphanages there. When she passed away, when we were in middle school, my sister had the idea of starting something in her memory, in my grandma's memory. And so we went to our school. I was in middle school at the time. She was in high school, and she put on a stuffed animal drive at her high school. I put one on at my middle school, and we expected to maybe get 100 stuffed animals. We ended up getting thousands from the community. And so we flew to Ghana, got to hand deliver them. There's a really cute picture of me as a kid, like a 12, 13-year old, getting to hand these out to kids. And that was really the beginning of my love of global service and realizing that sometimes giving back is as simple as quite literally handing someone a stuffed animal that doesn't have one. But when we came back, we said that was such an incredible opportunity. One, we want to give more people this opportunity. And two, how do we actually build this? And so we made it a nonprofit. And over the past 2 decades, we've led over, I think it's been like 10 trips now to places beyond just Ghana. We've gone to Ghana, Tanzania, Uganda, Kenya, and we've held not just stuffed animal drives, but we've done sports equipment, medical equipment, we've done school supplies, and we've worked with specifically on helping to build libraries and schools. And so I think for me, though, the most rewarding experiences that come out of all of that is actually getting to take students back to Ghana with us. And so it's been harder now with medical school and residency, but every 2 years we used to do where we would take students back with us and to Ghana, and we take about 15 to 20 along with some of the parents as well. And we host this incredible trip where it's both a cultural immersion, but it's also a service trip where we're going to schools, orphanages, and hospitals in Ghana and getting to expose the students to, one, a world that's beyond what they could have ever imagined, but B, showing that how impactful it is to give back in a way like that. So I think my most rewarding experience from Hugs has just been being able to expose other people to the same experience that I got when I was a young kid. That's now kind of inspired this whole lifelong desire to serve the community around me.
Well, it's a great story. I love the fact that your grandmother was the one that inspired it. And if I'm not mistaken, if people want to get involved, they could go to hugs4for.org. Is that correct?
Yes. Yep,
Okay.
that's correct. And we have links to get to sign up.
We'll put links in the show notes as well. So those are listening in, and then we will make sure that we guide you. Shifting gears a little bit, one of the things that I know you have on your site that I was impressed by, because a lot of people do TEDx talks, but you did a TED talk.
Yeah.
Maybe tell us a little bit about that, and were you nervous at all? It feels like that's such a holy crap kind of moment to have to do that.
Yeah. So I was selected as what's called a TED Fellow. I think 2 or 3 years ago now. What that means is they choose 10 people from around the globe to be supported by the TED organization overall. I was fortunate to be chosen as one of them for the work that I do on social media, but also kind of education just more broadly. And as part of that, we got to give a TED Talk. In the past, that TED Talk had been given on stage at the TED conference. My year, they did something different where we were giving kind of a TED video, which was really cool because I got to be kind of the vanguard of this new type of idea. And so if you go to the TED website, you can see it. But I don't know if I was nervous. Actually, no, I was definitely nervous. I think I was more nervous in the lead up to it because we had to write our scripts, we had to memorize it. And I feel like I just kept being like, I don't know what I want my focus to be. Like, this is going to be seen by hundreds of thousands of people. Like, what do I want my
Millions
focus?
millions of people, but yeah.
Exactly. Yeah, millions of people. Like, what do I want my focus to be? Because this could define like who I am as an individual. But I decided not to stray too far from the things that I typically talk about. I focused on kind of diversity, equity, inclusion in medicine, but also some of the work that I do and the stories that have been so impactful for me. And I think for me, it was really cool because we were at the TED conference where we got this filmed. And so we went to they took us to this private room. We sat down, of course, with all the cameras on us. They had an interviewer there. And I think it was like an hour and a half to 2 hours that we sat there just being asked questions about things that we care about. So it was truly one of the most powerful moments for me to be able to reflect and be able to say, man, I'm giving a TED Talk right now, but then also giving the next generation type of TED Talk right now. And so mine, like I mentioned, was about diversity, equity, inclusion in medicine, why it's important, what we lose if we don't actually think about it. And I think today it's been even more relevant than ever before. A lot of the things that I voiced as fears in the video have actually come true. Some of them, the solutions I pointed out, I think are more relevant than ever. So it's something that I'm proud of because it's timely. it's necessary. I think in the medical field, it's something that's my friends have even told me that's been shown in their classes in medical
Oh,
school
wow.
now.
That's
So that
cool.
was really, really awesome to hear.
Well, speaking of speaking, one of I think I mentioned earlier, we met a few years ago at South by Southwest, which is an
Hmm.
innovation festival in Austin. Great place to go. And you did a talk earlier this year. We're in 2025. So when people listen to this in 3 years, they'll know when they can go back to. You did a fireside chat with one of my former colleagues, Jennifer Paganelli, JPAGs, and then CEO, book author, and fellow podcast host, Moo Tomlinson, who we've had on the show earlier. Lovely man, and I
Hmm.
loved hearing the two of you. It was called Future Proof Healthcare Leading Through Disruption.
Yep.
It was actually one of my favorite South by Southwest conversations, and I'm saying this knowing that I've been there for 18 times and hosted a lot of content. One of my
Wow.
favorites of all time. So
Wow.
maybe share two or three highlights from that session, if you don't mind.
Absolutely. Well, let me say first of all, that's some high praise. And so
It's meant that way, but thank you.
I really do appreciate that. But I think we talked about so much that was so felt so relevant at the time. I think one thing that was really cool was the cross generations that we had. I mean, especially with Moo, I just feel like I kept looking at him and being like, I feel like either you're like we're related in some way, like, or maybe are you an older me, an older but better me? Like, what is happening right now? And so the conversation just like flowed so well.
Mm.
But really, I think some of the things that I think about still today was one, we talked about AI a lot, the impact of AI, and like how that can impact the information ecosystem, but specifically bringing it back to the healthcare system and how it's impacted. Moo speaking as a CEO of a healthcare organization, me speaking as a medical student. I guess I was as a doctor. I guess I wasn't a medical student at the time anymore, but as a recent medical graduate who's going through this, thinking about how is AI going to be impacting the overall system. We also talked about misinformation, which I think is something that even I mean, all these conversations. It's funny you talk about them years ago, and then you realize it's even more important today. But the rise in misinformation and disinformation, how that relates to things like physician burnout, how that relates to staffing shortages, things like actionable steps that we can be taking as the leaders of tomorrow, and thinking about how we're shaping just the future of healthcare overall. I know we talked about equity as design too, and so why equity can't be an afterthought in innovation, but has to be embedded from the start. And then also thinking about things like how we partner with patients, and so highlighting how patients need to be co-creating and designing healthcare solutions to build outcomes and trust. So, I mean, we talked about so much. I feel like it was such a wide-ranging conversation that really was impactful for me. One, I got a really good friend out of it, well, multiple friends out of it. But then two, I think it was just incredible conversation that shows how much more we need to go in healthcare, but also how far we've come.
Did you know Moo before that? Had you met him, like, other than prepping?
I had not met him, no, not
Mm.
at all. And so when we met, it was like truly, it was funny. I walked into the green room beforehand, and we were wearing kind of the same colored suit that looked exactly the same style with like a navy blue, black shirt underneath, and we were just like, okay, this is weird. And we get on stage and start talking. We're like, this is weird. And I kept running. I've run into him, I think, like 3 or 4 times now, without even knowing he was going to be at the events. And so, one at the Student National Medical Association, again, just recently, actually, at Essence Festival in New Orleans. And
Hmm.
so it's been cool getting to run into him still, and lifelong friend right there. And I got to be
He's a
on,
good.
and I
No,
was
go
on
ahead.
his
Sorry.
podcast as well. And so
Oh,
I got
you
to be
were.
on his
Okay.
podcast. Yeah.
I've been paying attention. I did not see you up there, but I will go ahead and give that a listen. And that's a good segue actually into the next section, which is you do a podcast. It's
Mm-hmm.
called The Dose, I believe. Tell us a little bit about the show and where can people digest it if they want to.
Absolutely. So The Dose is a podcast I work with by the Commonwealth Fund. And so we take really complex health policy topics and try and make them more human. So each episode, I explore some pressing issue from rural hospitals closing to reproductive justice to private equity in emergency departments or hospitals. And by interviewing experts and people who have lived experience, we talk about what it means for the healthcare system and for the world more broadly. And so my goal is always for listeners to walk away more informed, but also feeling like they have a stake in creating solutions and feel a little bit closer to understanding what is a very complex healthcare system in the United States with lots of different stakeholders. I think about a lot of my favorite shows and podcasts when I was growing up, and I think like this is the show that I would have wanted to listen to, where you're learning a lot about where healthcare is headed, but also getting to hear from experts and industry leaders about their fears, their worries, but also what has even driven them to get into the healthcare space in the first place.
Well, that's awesome. And then can people get that wherever they listen to their podcasts?
Absolutely. So you can find it on Apple Music, on Spotify, on YouTube, or you can just go to the website, thedose.org, I think it is. I'm probably getting that wrong. I should know it.
I can look this up as we're doing it. I'll put it in the show notes either way.
Yeah,
So.
I think it's the dose.show. That's what it is. And so you can find it there. We have a great website that has all of the episodes listed out, all the show notes, transcripts as well, and some wonderful designs as well.
And that is, in fact, it. I just validated. So we'll put that up. We'll have a link to your South by Southwest session if people want to see that, your TED Talk. I do want to shift gears a little bit into more of the fun questions, or at least the questions that get to know you a little bit more personally. And one is a new one I've been testing out on this podcast just because it's fun. Dirtiest sounding word that isn't actually a dirty word.
I feel like when I was growing up, my friends and I always hated the word moist. I feel like, I don't know if I feel someone's probably said that, but there's something about the word moist I just don't like. It's a gross word. It's not dirty, but it just sounds, I don't know what it is. Moist.
It's a perfect one, and it's funny. Samantha Ski, who's the CEO of She Media, which actually is owned by Penske, that does South by Southwest. She said that one is one of her words, and it's funny. It usually tends to be women that, for whatever reason, don't like that, but that's a good one because it is kind of a funny one.
Yeah.
This is a one I'm always really curious to find out of people, especially you who've met so many incredible people, but having met a lot of famous people, who has impressed you the most?
That's actually really difficult.
It's meant to be, but I appreciate that you see it as that.
Who's impressed me the most?
I mean, I guess you could cheat and just say Moo Tomlinson, right?
Yeah. Moo, it's you. Oh my goodness. I think, you know what I'll have to say? I'll have to say Stephen Colbert.
That's a good one.
Stephen is, man. So this is actually a funny story too, and I think about it. So he had come to, I went to Yale for undergrad, and he had come to give a talk on campus. And then afterwards, he was just walking around campus. And so, of course, everyone's running up to him, taking selfies. I got my selfie. But I was going to a show like a month later in New York, and we were in the audience, and he let one person ask a question from the audience. So, of course, I had to stand up and say, hey, I met you last month when you were at Yale. Can I take a picture with you on the set of the Colbert Report at the time? And so this was before, way before, at the Colbert Report. But yeah, I got my selfie. And the show was it was my first time really watching the show. I'd never watched it online. My friends had all talked about it. But I just walked away out of that blown away by how funny he is, how like the mix between satire and political commentary was just, I'd never seen anything like it before. And it really got me into getting into that world of like, wow, like media can be fun and interesting while also being educational. And so he's someone that I think to this day has inspired me. I've gone to a show now like 5 or 6 times. And every time I've walked away, like, wow, I've learned something, but I laughed a lot too. And I think that's a rare combination to be able to do.
So, Stephen, if you're out there listening, Dr. Joel Brevel really appreciates you, and you taught him a thing or two. So that's a good start. I love it. Let's talk a little bit about one of your biggest regrets.
I try not to live with regrets. I won't say that as an answer, though. One of my biggest regrets. Actually, I do know what it is. One of my biggest regrets was not doing a study abroad in college. I travel a lot now. One of my goals is actually to hit every country in the world. I think I'm at like 60 something right now.
That's impressive.
Yeah, but I love traveling. I'm the guy that will, if I have a 3-day weekend, I'm in a different country. I'm not in a different state. I'm in a different country. But I think one of my biggest regrets, I wish I had taken, because now it's hard to do a whole semester. And so I wish in college I did a whole semester somewhere, whether it's Spain or South America or East Asia. I think that would have been cool.
Well, after you do your residency, you'll have to make sure that you get around and hit, what are there, 220 something countries in the world?
Yeah,
right now, I think?
I'm only less than a quarter of the way there. So I have a lot way to go.
I think I've done 20. So you're ways ahead of me. And I feel like I've traveled a lot. But all right, my last question, and then we'll let you go, because just so folks are listening in, we're recording this at 7 o'clock Pacific time, which we're both in, on a weekday because of the fact that Joel is a very busy man, so he was kind enough to roll with the punches on this one. The last one's a fun one, and that's just to name one band or artist that you would wish you had seen in concert.
Okay, one band or artist that I wish I'd seen in concert. I have to preface this by saying I go to a lot of concerts. I've been to Coachella for the past 4 years. Obviously, South by Southwest, I love. One person I haven't seen that's on the come up right now, that I'm going to put everyone on, Doechii. But she's going on tour this year, so I'm going to see her. And I was really sad because in DC, I was there with TikTok, had these great spots, but had to fly back for residency. And I was so sad because I was going to be perfect. But I'm so excited to see Doechii one day live in person. I think she is the epitome of a performer, someone who puts her art forward, uses the stage as a piece of conversation, as her canvas, and yeah, I'm just truly impressed by her all the time.
Well,
So
it's an
Doechii,
excellent choice.
if you're listening, Doechii,
That's right, Doechii. Listen, we'll have Doechii on the show sometime soon.
yeah,
And I only say that half-heartedly. There was an experience I had like that. Fortunately, I did get to see them a number of times afterward, but I went to UMass Amherst, and this is a million years ago. And there's this band called the Red Hot Chili Peppers, and I had heard of them, but they weren't nearly as famous as they were. And they played this free concert out on the Commons. There were probably 300 people there. And I had to go to work that day.
Oh,
and it was
man.
just as dumb like work in the snack bar. And so I still to this day think about to myself, I could have seen the Red Hot Chili Peppers
yeah,
with 300 people before they
yeah.
got big. I did see the band Fish, although I didn't really appreciate it at the time, in a fraternity house with probably
Wow.
50 other people before they got big. So, but I like Fish. I really liked Red Hot Chili Peppers. But we will wrap up on that note. Dr. Joelle Burvell, thank you so much for taking the time to do this. Really great to talk to you. I would encourage anyone, and again, we'll put this in the show notes, go and follow him, whether it's TikTok, whether it's on Instagram, whether it's on YouTube, listen to his podcast, but really tons of great content. And he is doing an amazing job sort of helping helping these populations that are disadvantaged and demystifying some of these myths that are out there that, when you're just telling your story up front about sitting there and asking this question, I always have this policy that if I am wondering about this, there are probably 10 other people in the room. And if there are 10 other people in the room, there are 10,000 or 10 million people in the world that are wondering. So with that,
Exactly.
thank you so much for your time today.
Thank you. I really appreciate it.